Before you reach for your prescription bottles this morning, there is something critically important you need to understand. A comprehensive body of medical research is revealing that four of the most commonly prescribed medications seniors take every single day are not just failing to deliver their promised benefits. In certain combinations and certain dosages, they are actively undermining your health in ways your doctor may not have fully explained. We are talking about medications that are sitting in almost every senior's bathroom cabinet right now. And on the other side of this, there are four treatment approaches that research links to better heart health, improved mobility, enhanced cognitive function, and in one case, a dramatically lower risk of hospitalization. By the end of this analysis, you will know exactly which medications to discuss with your doctor, which alternatives to consider, and why understanding the difference matters more than most people realize. Stay with me because the number one medication on the reconsider list is the one that changes everything. The reason this matters so profoundly comes down to one fundamental fact about aging. The body at 70 is not the body at 50. The liver metabolizes drugs more slowly. The kidneys eliminate substances less efficiently. The digestive system absorbs compounds differently, and the cardiovascular system becomes more sensitive to chemical changes. So, a medication that was perfectly appropriate and helpful at 55 can become a serious risk at 70, not because the medication changed, but because you did. The same prescription, a completely different outcome. And the concerning part is that most medication labels do not adequately warn you about this. Most physicians do not have sufficient time to review every potential interaction during a brief appointment. So the knowledge gap remains open, and seniors continue taking medications that are quietly compromising the very health they are trying to maintain. Here is what makes this different from the standard medical advice you have probably encountered. This is not about adding more prescriptions to your regimen. It is about being more informed about the ones you already have. And for four specific medications, the research is remarkably conclusive. These are not controversial opinions or preliminary findings. They are supported by peer-reviewed studies published in leading medical journals. Once you understand why these four work and why the other four create problems, you will not look at your medication schedule the same way again. You will be more knowledgeable than most people making these decisions, and that understanding is genuinely empowering. Proton pump inhibitors, the double-edged sword. Proton pump inhibitors, commonly known as PPIs, are one of those medications that genuinely seem like they should be on everyone's treatment plan for acid reflux. They reduce stomach acid production, they alleviate heartburn, they help heal ulcers, and in the right circumstances and the right duration, all of that is true. The problem begins when the use extends beyond the recommended 8 to 12 weeks, which is the time frame found in most clinical guidelines, and when the prescription continues year after year in a body that is experiencing cumulative effects most patients never anticipated. PPIs work by blocking the enzyme system in stomach cells that produces acid. While this provides immediate relief from reflux symptoms, it fundamentally changes the digestive environment. And as the digestive system ages and becomes less resilient, the long-term suppression of stomach acid does not simply neutralize heartburn. It creates cascading nutritional deficiencies. Month after month, the consequences accumulate, and at a certain point, they begin to cause measurable harm. Margaret, 68, has been taking omeprazole for 5 years. The prescription started after a bout of severe heartburn. She never questioned continuing it. Over the past 18 months, she has been dealing with increasing bone fragility, recurring urinary tract infections, and a persistent weakness she attributed to normal aging. When Dr. Linda Harrison finally reviews her complete medication history and orders comprehensive testing, several deficiencies emerge. The PPI she had been taking daily had been quietly depleting essential nutrients the entire time. Research published in JAMA Internal Medicine has found that seniors using PPIs for extended periods face a significantly higher risk of hip fractures, chronic kidney disease progression, and an increased incidence of pneumonia and intestinal infections. The mechanism is clear. Stomach acid is not just for digestion. It is the body's first line of defense against pathogens and a critical factor in absorbing calcium, magnesium, vitamin B12, and iron. The safe approach for most seniors is to use PPIs only for the shortest duration necessary to heal acute conditions, typically 8 to 12 weeks maximum. For ongoing reflux management, lifestyle modifications, such as elevating the head of the bed, avoiding trigger foods, reducing meal sizes, and losing excess weight, often provide substantial relief without medication. If acid suppression is still needed after these changes, H2 blockers like famotidine offer a gentler alternative with fewer long-term risks. The fix is not to stop PPIs abruptly without medical guidance. The fix is to have an honest conversation with your doctor about whether continued use is truly necessary and what alternatives might be appropriate for your specific situation. Benzodiazepines, the sleep aid that steals your balance. Benzodiazepines have been prescribed to seniors for decades as a solution for anxiety, insomnia, and muscle tension. And for short-term use in specific situations, they can provide genuine relief. But here is the part that almost no one explains clearly enough. After 65, the risks associated with benzodiazepine use increase dramatically. And for those taking them regularly, especially for sleep, continuing anyway is one of the most significant preventable causes of falls, fractures, and cognitive decline in older adults. Benzodiazepines work by enhancing the effect of a neurotransmitter called GABA, which slows down brain activity and induces relaxation. The problem is that this same mechanism impairs balance, coordination, reaction time, and memory formation. In younger adults, these effects wear off relatively quickly. But in seniors, the drugs accumulate in fatty tissue and take much longer to clear from the system. The half-life, the time it takes for half the drug to leave the body, can extend to days rather than hours. So, it accumulates. And accumulated benzodiazepines create a state of chronic sedation that most users do not even recognize as abnormal. Thomas, 73, has been taking lorazepam for sleep for 3 years. He was never offered alternatives. He took it for granted that the medication helping him fall asleep was improving his overall health. Daytime drowsiness, occasional confusion, difficulty concentrating. When Dr. Linda Harrison reviews his medications during a routine visit, she immediately raises concerns. When Thomas finally undergoes cognitive testing, his scores show significant impairment. The benzodiazepine he had been taking every night had nowhere to go during the day. A 2019 study published in BMJ found a strong association between benzodiazepine use in older adults and increased risk of dementia, with prolonged use showing even stronger correlations. Other research has linked these medications to a threefold increase in fall risk, higher rates of motor vehicle accidents among senior drivers, and increased mortality in patients with chronic respiratory conditions. The symptoms of benzodiazepine dependency, fatigue, memory problems, poor coordination, social withdrawal are so similar to normal aging that most people never suspect the medication. The action step here is straightforward. If you are taking a benzodiazepine regularly and have been doing so for more than a few weeks, schedule a conversation with your doctor about tapering off gradually under medical supervision. Abrupt discontinuation can cause dangerous withdrawal symptoms, so this must be done carefully. For sleep issues, cognitive behavioral therapy for insomnia has been shown to be more effective than medication in the long term. For anxiety, counseling, mindfulness practices, and in some cases, safer medication alternatives may be appropriate. Benzodiazepines serve a purpose, but only for short-term use in carefully selected situations. Anticholinergic medications. The memory thief hiding in plain sight. For years, the message has been simple. Trouble sleeping? Take diphenhydramine. Overactive bladder? Take oxybutynin. Seasonal allergies? Take an antihistamine. These medications, known collectively as anticholinergics, are available over the counter, prescribed routinely, and sitting in nearly every senior's medicine cabinet. And they do work for their intended purposes, but the way anticholinergic medications are being used by most seniors, often multiple drugs from this class simultaneously, is not just treating symptoms. In many cases, it is damaging the brain. Here is why. Anticholinergic drugs work by blocking acetylcholine, a neurotransmitter essential for muscle control, learning, and memory. When you are younger, your brain has enough acetylcholine reserve to withstand this blockade without noticeable effects. But after 65, acetylcholine levels naturally decline. When medications further reduce what little remains, the effects are not subtle. They include confusion, memory loss, difficulty concentrating, and over time, measurable brain shrinkage. Acetylcholine does not work in isolation. It needs adequate hydration, good sleep quality, and the absence of competing medications that block its receptors. Without those conditions, cognitive function deteriorates progressively, and an aging brain under constant anticholinergic burden is facing a problem that is very difficult to reverse. Research published in JAMA Neurology found that seniors taking strong anticholinergic medications had significantly greater brain atrophy and lower glucose metabolism in the brain compared to those not taking these drugs. A separate long-term study demonstrated that cumulative anticholinergic exposure over several years was associated with a 54% increased risk of dementia. The better approach is to identify all anticholinergic medications in your regimen, including over-the-counter sleep aids, allergy medications, and bladder control drugs, and discuss alternatives with your doctor. For sleep, melatonin or behavioral strategies may be effective. For allergies, newer non-sedating antihistamines like loratadine carry minimal anticholinergic effects. For bladder issues, pelvic floor therapy and scheduled voiding can reduce symptoms without medication. If anticholinergic drugs are still necessary after exploring alternatives, they should be used at the lowest effective dose for the shortest possible duration, and cognitive function should be monitored regularly. Non-steroidal anti-inflammatory drugs, the pain reliever that hurts your heart. Non-steroidal anti-inflammatory drugs, or NSAIDs, are water-soluble medications, which is why most people assume they are completely safe for regular use. The logic seems sound. Take them for pain. They reduce inflammation. They leave the body quickly. There is nothing to worry about. But NSAIDs have cardiovascular and gastrointestinal effects that accumulate even if the drugs themselves do not, and the consequences of regular use in seniors can be serious and in some cases life-threatening. When NSAIDs are taken regularly over an extended period, even at standard doses, they do not simply relieve pain and inflammation. They interfere with prostaglandins, compounds that protect the stomach lining and regulate kidney function and blood pressure. Over time, this interference causes real damage to organs that are already more vulnerable in older adults. Research published in Circulation found that older adults taking NSAIDs regularly had approximately double the risk of developing heart failure compared to those who avoided these medications. The official guidance from the American Heart Association recommends extreme caution with NSAID use in anyone with existing cardiovascular disease or risk factors, which includes the majority of seniors. Dorothy, 70, started taking ibuprofen daily 2 years ago for arthritis pain. She also takes a low-dose aspirin for heart protection and a prescription NSAID from her rheumatologist. Over the past year, her blood pressure became harder to control. She developed stomach pain and black stools. She retained fluid in her ankles. When Dr. Linda Harrison reviews her complete medication list, the combined NSAID burden gets flagged immediately as a likely contributing factor. The pain relief she sought had been creating cardiovascular and gastrointestinal stress she never connected to the medications. Seniors managing chronic pain need only about 200 to 400 milligrams of ibuprofen occasionally for acute flare-ups, not daily doses. Alternative approaches like physical therapy, heat and cold therapy, topical pain relievers, and in appropriate cases, acetaminophen provide relief without the same cardiovascular risks. If your pain management strategy involves daily or near-daily NSAID use, it is worth discussing with your doctor. More is not better. In this case, more is genuinely dangerous. Now that you know which 4 medications to reconsider, let us talk about the 4 approaches that research consistently supports for seniors. These are not experimental treatments or unproven methods. They are well-studied interventions with decades of evidence behind them. And the last one on this list, the number 1 strategy you must implement daily, is the one linked to the most dramatic improvement in overall health outcomes we will discuss today. Let us get into it. Strength training, the foundation of healthy aging. If there is one intervention that is quietly neglected by the majority of seniors and almost never emphasized in the right way, it is resistance exercise. Strength training, whether with weights, resistance bands, or bodyweight exercises, addresses the fundamental process of aging at the muscular and skeletal level. It builds muscle mass, it strengthens bones, it plays a direct role in metabolic health, balance, independence, and longevity. And as we age, the body loses muscle mass naturally, a process called sarcopenia, while sedentary behavior accelerates it further. A 2021 study published in the British Journal of Sports Medicine found that muscle strengthening activities in older adults were associated with a 15% lower risk of all-cause mortality, significant reductions in cardiovascular disease risk, and improved physical function. Seniors who incorporate resistance training twice weekly frequently report better balance, fewer falls, improved mood, and greater confidence in daily activities. The best approach for seniors is to start with light resistance and focus on proper form rather than heavy weights. Exercises targeting major muscle groups, such as squats, chest presses, rows, and leg lifts, performed 2 to 3 times per week with at least one rest day between sessions, provide substantial benefits. A typical program discussed in clinical settings includes 8 to 12 repetitions per exercise for 2 to 3 sets, though the right intensity depends on individual fitness level and should be confirmed with a healthcare provider or qualified trainer. Mediterranean diet pattern, food as medicine. The Mediterranean diet is frequently called the gold standard eating pattern for aging adults, but by the time most seniors learn about it, they have spent decades eating a different way, and changing established habits feels overwhelming. The Mediterranean pattern is not just about individual nutrients, though it does provide abundant antioxidants, healthy fats, and fiber. It functions more like a comprehensive anti-inflammatory system, influencing cardiovascular health, cognitive function, and metabolic stability. Research has consistently linked adherence to a Mediterranean-style diet in older adults to reduced risk of heart disease, stroke, type 2 diabetes, and cognitive decline. A landmark study in the New England Journal of Medicine found that seniors following a Mediterranean diet supplemented with extra virgin olive oil or nuts had a 30% reduction in major cardiovascular events compared to those on a low-fat diet. The important detail most people miss is that the Mediterranean diet is not a restrictive plan. It emphasizes abundance rather than deprivation. The foundation includes vegetables, fruits, whole grains, legumes, nuts, seeds, and olive oil as the primary fat source. Fish and poultry are consumed regularly. Red meat and processed foods are limited. Meals are prepared simply and enjoyed socially when possible. For seniors, this single dietary shift can be the difference between managing multiple chronic conditions with medications and preventing them through nutrition. Implementation should be gradual, starting with 1 or 2 Mediterranean-style meals per week and building from there, and guided by personal preferences and any existing dietary restrictions. Cognitive engagement, the brain's best defense. Cognitive stimulation, particularly activities that challenge memory, problem-solving, and learning, is among the most consistently studied interventions in senior brain health. These activities are not games in the trivial sense, but they function as a foundational protective factor against cognitive decline. And for seniors dealing with the natural slowing of mental processing, which is one of the inevitable aspects of aging, regular cognitive engagement is one of the most well-supported protective strategies available. Research published in Neurology has indicated that seniors who engage regularly in cognitively stimulating activities such as reading, playing musical instruments, learning new languages, or strategic games like chess or bridge show slower rates of cognitive decline and reduced dementia risk. Separate studies have linked higher levels of cognitive engagement to better memory performance and greater brain volume in areas associated with learning. The primary activities that provide benefit are those that require active thinking rather than passive consumption. Learning a new skill, taking classes, doing crossword puzzles or Sudoku, engaging in meaningful conversation, and teaching others all qualify. For those who prefer structured programs, evidence-based computerized cognitive training programs providing 20 to 30 minutes of practice 3 to 5 times per week have shown measurable improvements, though real-world activities involving social interaction may provide additional benefits beyond cognitive training alone. Now, here is the one we have been building toward. Individually, strength training and cognitive engagement are powerful, but research has begun to examine what happens when both are practiced consistently by seniors throughout their later years. A comprehensive study published in The Lancet found that seniors who maintained regular physical activity combined with ongoing cognitive stimulation had a 60% lower risk of developing dementia compared to those who were inactive both physically and mentally. That number is not from a single small trial. It is drawn from large-scale longitudinal research and has been validated across multiple populations and settings. The reason the combination matters so profoundly is that physical exercise increases blood flow to the brain, promotes the growth of new neurons, and reduces inflammation throughout the body. Cognitive activity strengthens neural connections and builds cognitive reserve, the brain's ability to compensate for age-related changes. When both are practiced together, they create a synergistic effect that neither achieves alone. And the data on that synergy is among the strongest in geriatric medicine. So here is where we land. 4 medications that research suggests seniors should approach with serious medical oversight. Proton pump inhibitors used long-term, benzodiazepines for chronic use, anticholinergic medications taken regularly, and NSAIDs used daily, and 4 interventions that are among the most well-supported for healthy aging: strength training, Mediterranean diet patterns, cognitive engagement, and the combination of physical and mental activity together. The action steps you can take today are practical. Review your medication list with Dr. Linda Harrison or your healthcare provider, specifically asking about PPIs, benzodiazepines, anticholinergics, and NSAIDs, and whether safer alternatives exist for your situation. Schedule baseline assessments for bone density, cardiovascular health, and cognitive function if you have not done so recently. If you are not currently engaging in regular strength training or cognitive activities, those are 2 of the most impactful changes to implement. You now have a clearer understanding than most people ever receive about what is actually happening inside the body when you take a medication or make a lifestyle choice. That knowledge is yours to act upon. If this analysis helped you think about your medications differently, leave a comment below and tell us which one surprised you most. And share this with someone over 65 who is managing multiple prescriptions. It could genuinely make a difference for them. The next analysis in this series examines blood pressure medications specifically, how to interpret your readings, the difference between various drug classes, and who benefits most from intensive versus standard treatment targets. That one is coming soon. Make sure you do not miss it.